Yeah, so tracheostomies are small plastic tubes inserted into the necks of about 15,000 people typically in the UK per year. The majority of them are done for patients in intensive care who need help with their breathing, particularly when they're recovering from critical illness and they've been on a ventilator for some time. Um, Patients have problems with communication because they can't speak when they've got a tracheostomy in, and they have problems eating and drinking because it affects your swallowing ability. And from a medical perspective, these plastic tubes need a lot of looking after to keep them safe. So while they are life-saving in a lot of senses for patients, they can also be life-threatening, particularly if they're not looked after properly. That creates a whole load of problems for caring for these patients, which were particularly highlighted by the COVID pandemic, when we were looking after lots of patients who needed ventilation, which translated to lots of patients who needed tracheostomy. And because of this, the surge in critical care cases, we were managing a lot of patients in areas that were not used to managing patients with tracheostomies. When the focus on COVID came along, we looked back at some of our early work around safety and tried to work out how we could rapidly make these existing and new locations where patients with tracheostomy will be cared for, make them safe as quickly as possible. And so we use the toolkit as a way of boiling down all of our big package of interventions and quality improvements into three key safety elements, which were around making sure the patients are in the right place, making sure they were looked after by staff who'd had some appropriate training, and making sure that essential information about the patient's airway was displayed with these things called bedhead signs. When COVID came along, that's when the AHSNs realised we had to do something quickly with this programme, and that's why we focused on the emergency elements. And what the AHSNs and the patient safety collaboratives have done was take those key elements and then roll those out into those into hospitals in the different patches throughout the AHSNs. And the sort of reformatting of that work was very rapidly done by colleagues in Health Innovation Manchester, who were sort of leading the charge, if you like, on working out how we can do this quickly and developing appropriate resources. And that's what turned our comprehensive QI program into this sort of rapid toolkit that staff could take to the bedside and start to improve care almost straight away. Now we've got a few anecdotes back at the moment, but patients telling us that their first cup of tea, the impact of having that first cup of tea when you've been critically ill for 6 weeks, or being able to tell your family that you love them because you've got your voice back. And if we can do that a day or a week or a month earlier by implementing some of these sort of quality improvement measures, for the patients, it's massive. The feedback from patients when we can implement some of these things and get them talking, eating and drinking earlier is amazing. And if staff know what to do and they're not afraid to look after patients with these tracheostomies, it has a huge impact on their day-to-day work. If you're going to work in fear of doing something wrong, or because you don't know what this thing is, and then of course you don't want to go near it, then the patients could potentially come to harm because they're not getting the care that they need. And so empowering staff to look after patients with tracheostomies, it makes their day job a lot less stressful because you know what you're doing. It takes away that fear factor. The patients then aren't surrounded by people who are, really anxious about this bit of plastic sticking out of the neck. They don't know what it is. And that makes the patients less anxious. So, just really simple things can have a really positive impact on the way that our staff are caring for the patients, and importantly on the way that the patients are feeling they're being looked after.